We did an additional analysis in order to understand a particular subgroup that is of special interest in patients who have been treated with treatments that ultimately aim to reduce the level of minimal residual disease. And this is the subgroup of patients who have a partial response after venetoclax-obinutuzumab. And we have previously seen with trials using chemoimmunotherapy in patients with CLL that this subgroup of patients who only have a clinical partial response to their treatment but still have undetectable MRD levels in the blood are ones that have a similar or sometimes even better outcome than patients who have a clinical complete response after treatment. And therefore, we wanted to see whether this also applies for patients who have received venetoclax-obinutuzumab. And indeed, we again see this pattern of patients who have undetectable MRD but still mild residual lymphadenopathy and therefore, per definition, a partial response to treatment. We do see that this subgroup of patients has an excellent PFS and similar PFS to patients who have a complete response and undetectable MRD, and actually a better outcome than patients who have detectable MRD with a clinically complete response. So we do see by this that the value of minimal residual disease as a surrogate for the success of the therapy is very meaningful and probably even more sensitive than our traditional approaches of assessing response to treatment.